Welcome back. While today is the International Day of Action for Women's Health, a Kindercare study, in fact, found that almost all, or 92% of working mothers feel overwhelmed. Around about 63% have missed work to take care of sick children. And of course, more than anything else, how is it that women can better take care of their health? And are we conscious enough of our health? Let's discuss all these matters now with Dr. Nomacete Tshume, who is joining us from Kindercare. Thank you so much, Doc, for your time. A very good morning to you, and welcome to the South African Morning.
Good morning, Faith. Thank you for having me.
Let's talk a little bit about women's health. You know, a lot of times one would say that women, though, taking better care of themselves than perhaps our male counterparts. However, when it comes to being able to even afford health care, and afford services that come with health care, you know, whether it's going to a gynecologist, whether it's taking care of myself, whether it's understanding that I have endometriosis, all the issues that women have to confront themselves with on a day-to-day basis. I wonder if our health care is actually adequate enough to be able to cover all of these issues that women contend with.
I think because women are the mother, they take care of the home, they put themselves second. The children come first, the husband comes first, making sure the household is running. So it's inadequate in that sense because we don't put ourselves first. So days like this make us become more aware that you want to take care of your health because there's education now. There's International Women's Health Day.
More than anything else, it's also about how women have to be the end-all and be-all for everybody in the family, right? And I can imagine how much stress and how much depression subsequently that causes, because if you're looking after the home as a mom and as a caregiver, you're looking after the husband as an additional caregiver. You're having to provide because, you know, the economic climate of our time now no longer allows for just one income household. So now you have to go out there and work. You have to come back home, cook, clean, take care of the children, bathe the children. Somewhere in there, there's you. Are we having these kinds of difficult conversations with the families to say, you really cannot be everything to everyone at the same time?
It's a mental health burden, honestly. I think as a working mom myself, full-time working mom, full-time mother to a toddler, I run a house, everything else as well, and a doctor at the same time, I know. But the thing is, if you are not aware that this is actually it's actually a mental health issue. If you're not aware, then what are you going to do? You won't know what steps to take. So this is why these days are so important for that very reason.
A lot of times, and again, where do women go to feel included or to feel heard and seen? And I'm saying this in light of the fact that perhaps what we also as women suffer from, and I know this, because it takes a long time for women to open up to other women and not wanting the other woman to judge them. So they would rather have this perfect picture and this perfect person. I've got it all together. I've got it all, right? We love the perfect facade. And at the end of the day, it is a facade because it actually does affect your mental health. But where do women go to find spaces of safety so that they can bring up some of the challenges that they're confronted with?
So that's the perfect question for me because that's what my job is all about on Kena Health. We're bridging that gap between you having to make an appointment to go see a doctor. The cost, much lower cost, 185 Rand for a full consult with the doctor. You go through a nurse. The nurse listens to your issue and directs you to the right professional, whether it's a mental health professional or it's a medical doctor. Then also there's an express queue. If you've got a chronic script, you've been on consider for like a long time, you can go to the express queue. It's 120 Rand. You get your script there. So we have mental health professionals online as well that you can speak to. So in my job, that's where we're trying to bridge that gap where you can go to. You've got people to speak to, and you have medical professionals that can assist you as well.
And of course, more than anything else, women also like the confidentiality that is included with everything, right?
You just have to be on your couch and you just get your phone, and there's a doctor on call there for you.
And I was sharing with my my co-host, Morena, that even on this kind of a day, I can't even get out the house, never mind even find it. So how many women actually struggle to get out of the house, either because of economic reasons, and sometimes the doctor is too far, right? Especially in the rural communities, right? And then there's time as well, convenience and space. So just talk to us a little bit about how it works. So if I'm hearing about Kindercare Health for the very first time, how does the platform actually work? Because I love the fact that I can do everything in the comfort of my home.
So first of all, you go and search for Kena on your app store, Kena. Then you download the app, put in all your information. Then it's going to ask you for what your issue is and direct the bot. There's a bot that actually directs you. She will send you either to a nurse, mental health queue, whatever. And then they then do the assessing of what needs to be done. Can they help you with a recommendation? Can they give you advice? Or do you actually need to speak to a doctor? If you need to see a specialist, then we would refer you out to a specialist that we think you need.
Yeah, including mental health issues.
We have mental health professionals on call as well during the day, from 8 until 8 during the week.
From 8 a.m. until 8 p.m.
Correct. And then the weekends, Saturday, 8 until 5, and then Sunday, 8 until 2.
Yeah, and again, it starts becoming a notion of community, and how is it that you can build a community of women and a community of doctors to be able to speak to some of the needs that women have. And more than anything else, I think it's a message that you're a woman first before you're a mother, before you're a wife, before you're a caregiver, you know, before you're somebody's child. You're still a woman first. And how then do we start inculcating, maybe even re-engineering, rewiring the brain, so that women start seeing themselves as, I'm a priority. If I'm not okay, nobody can be okay in the family. How do we start having those conversations?
But that's exactly why these kind of days, like I said, this is where we start, by educating people through days like this. Education, awareness, because prevention is better than actually treating. So if we can get women to understand that there are lifestyle choices that they can make right now that can prevent those illnesses that actually need severe intervention medically. So we need to take every opportunity we have to educate. That's why platforms like Kena are there, because we want to educate. We want to get the message out there so women know there is help and you can get it early. You don't have to wait until you need to go to hospital to get the assistance. Yeah,
and again, it's about, especially when it comes to public health care, pricing also becomes important. Women go to public healthcare because, unfortunately, private healthcare is not accessible to all South Africans. If you do not have medical aid, really, it's near impossible to be able to get a consult, because it's costing within the 2,000s or the 3,000s, depending on whatever it is that you're trying to actually merge. And Ken is actually able to tackle that because you're not as expensive, for example, as private healthcare.
We're cheaper than going to a GP face-to-face. It's 185 Rand, and you can speak to a GP and get a script just like you would there, even a sick note, a referral, etc. So, yes.
Sure. And around, you know, being also, how available is the app? So is it just across South Africa? Is it across
South Africa?
Yeah, it doesn't necessarily...
And if you've got a passport and a South African number as well, you can register on Kena.
And it doesn't matter, and you can be of a foreign national, basically, but you just have to have a passport
and a cell phone number for South Africa.
Sure. And around just being able to spare these messages of awareness, how are we faring in being able to gain the trust? It's one thing to spread the message and say we are available, utilize our platform. It's another thing to actually gain the trust of the woman concerned, who will be able to put their lives on the line and say, you know what, actually, let me go to Kena. How are you faring in being able to bridge that gap of trust?
I think we're doing quite well because 70% of our patients are actually female, and it's all conditions like STIs, the contraception. So it's working. It looks like women are happy to actually consult on the app, comfortable with the professionals they are speaking with, by the numbers that we are seeing. So we are gaining the confidence. The numbers are high.
Yeah, I want to lay on this issue around contraception and some of the services that you also offer. Because as I said, anonymity becomes so critical, or you know, confidentiality becomes so critical in these conversations. Where do you find a lot of your patients, female patients, actually gravitating towards in terms of just the needs basis on that platform? Is it a lot of times to do with mental health, or is it STIs? Is it reproductive health? Where are you finding
those are the three top ones? It's the STIs, the mental health, and the contraception. So the chronic patients, somewhere there as well, but it's mainly those three platforms. They need the mental health professionals, they need the contraceptive scripts, they need treatment of their STIs or upper respiratory tracts as well.
Yeah, but then it speaks around to a bigger conversation about women owning their powers even within the spaces of their homes, doesn't it?
Yes, of course.
You know, and how is it that they can become more empowered to have a conversation of, I want to use a condom because I want to be able to protect myself? And are the homes, patriarchal homes in South Africa, do we still allow for those conversations to happen?
It's still difficult. That's why people are looking for the contraception. They want to be on the pill or the injection. They want to know what options they have, because most times the partner doesn't want to use a condom. And then we lead to STIs.
Yeah.
And a lot of people don't want to test for HIV these days. Like, they're very happy to tell you that, oh, I'm worried that I might have an STI. But you say, have you tested for HIV lately? No. It's not a priority anymore. And that's one of the things we try and do. We educate you that an STI involves HIV. It's not just the discharge. If you have an STI, you likely could also have contracted HIV, so you need a test. So we use that opportunity to also do that education.
And more than anything else, it's about how STIs, if they go untreated, could lead to further chronic diseases such as I think is it cervical cancer?
Yes.
For example, if you have, for example, and a lot of times a woman say, no, I'm fine, I'm fine, until it obviously progresses to something even more serious, such as cervical cancer. Then you guys have to almost fix instead of preventing.
Yeah, the cervix cancer is something that I don't know how we're progressing out the HPV vaccine. That's part of that education as well, about ladies, young girls getting HPV vaccines in their teens to prevent them getting HPV, which leads to cervix cancer. The other thing about recurrent STIs as a problem is that it causes a sticky pelvis. You keep on getting these infections. Eventually, when you're trying to conceive, you wonder why.
Am I struggling to conceive?
Why you're struggling? Yeah. Because your tubes are blocked from continuously getting these STIs. And I try and tell ladies this, that you can't keep coming back 3-4 times a year with STIs. You need to make a firm decision how you're going to protect yourself now. Because eventually, when you want to have a baby, she's 21 now, 20, it's not a concern. 4 or 5 years' time, when you want to try and conceive, you won't be able to, because your tubes are blocked, because you've been having these infections.
Sure. So it is Kena Health that I'm able to just to download on my cell phone, and of course you get Kena, and then you've got somebody who's waiting to consult with you on whatever issues that you've got.
Precisely.
Much appreciated, Doc, for your time in that. Thank you so much.
Thank you, Faye.
Of course, it's Dr. Nomacete Tshume, who is a general practitioner at Kena Health, just talking to us a little bit about some of the access that is available for women. Plus, it's affordable access available for women, especially when it comes to some of the reproductive health and the sexual health and everything else that is concerning you. Remember, you are important. If you're not okay, then there's a big problem with that.